bring my hands together, and I'm just going to bring the leg back, and then I'm going to just hold it. Okay, now what I want to do is a pre-test. So I'm going to just check and see how far an extension Erin's leg can go. So I've got my two hands. What I saw you guys doing is lifting the leg. No, just leave your hands on the table and slide the leg back. And you can just say, okay, I feel it to about here, make a note of it, and then you're gonna come back and start the session. Step one, and I'm not gonna really work, it's flex foot and release. Flex foot. Can I get some beeswax so it just flows a little more? My hands are so dry.
Use this.
Thank you. Flow through it. Okay. This one is the gastrocsoleus medial midline, flex and release. Flex and release. Flex and release. Behind the medial malleolus and off the calcaneus. Now I'm going to walk around. And I'm going to work the calcaneus. Flex your foot and hold. Okay, you can do it with your fingertips or your necks. Okay. And now we're going to go ahead and do the lateral arch. So flex and hold, toes down, foot, toes down, toes up, and foot up. Lateral arch, okay, and relax everything. And now toes down, and toes up, and foot up. And here's her medial arch. And I'm just going to make sure that everything feels adaptable. Okay, good. Now, medial border of the tibia. I like to do it from this. By the way, at the beginning, you can also do side strokes like this, just to open up the tissue. I do this often, just to open it up. You can actually do this all the way up and just kind of go across like this, just to open up the tissue. Okay, medial border of the tibia. What you're going to do is just find the tibia, and you're going to fall off the edge. Now flex foot, knee forward, knee back, and step, and relax everything. You're just going to do that many times. And you go flex your foot and hold all the way down. Okay, medial knee tracking. This is the one where you just want to make sure pes is not glommed up. Just make sure. And if you feel some stickiness, you can do a little spreading on that pes. And then you're going to anchor your hands. When you anchor your hands, you're looking at a place where that patella is straight. Okay, so this looks good to me. And now, Erin, imagine, flex your foot and imagine someone's pulling your knee forward. And as she's going forward, it's allowing my hands to fall back. Now bring your leg back, and I'm just gonna make some space here. Okay, good. And then just relax everything. Balance the medial thigh. Well, there's a couple ways we can do it depending on what needs to happen. I often will do it like this and create some chevrons like this, or you can do it like this, but you're gonna put the leg where you want it and make it stay, right? And in Erin's case, we just need to really keep looking for this medial midline. Okay, and at the top, I'm going to go ahead and use my elbow, sink in, and take my elbow away from the ramus. And now Erin, turn tail under and release it. And turn tail under, good, and release it. Okay? Now, that's the ramus. So now we're going to do the septum. So place my hands on the inner thigh, lift your leg up, good, and back down. Here's the adductors. And I'm just going to fall off the adductor and the hamstring septum. I'll sink in. Now flex foot, knee forward, knee back, and step down. Okay. Flex your foot, knee forward, knee back, and step down. Flex your foot, knee forward, knee back, and step down. And again. And I'm just working my way all the way up that septum. Step down. Okay. Here's this one. This is between the quad and the adductor. Flex, knee forward, knee back, and step down. And sometimes, you guys, I do just allow my hand on this first one to just feather through the knee. Flex, knee forward, knee back and step down. Knee forward, knee back and step down. And you know, when you're doing this, the goal, what we're doing here is making sure that the adductors and the hamstrings aren't involved when that knee floats forward, because it's not their job. So flex, knee forward, and I don't want that adductor to go with it. And one more here, flex, knee forward, knee back and step down. Good, and now the adductor group. So we've just created a better alignment here for the adductors. Now we're gonna go straight up the adductors. So anchor the tissue, flex, knee forward, knee back and step down. And then people ask, I gently sometimes will just hold here, flex, knee forward, knee back and step down. Nothing major. But here I really am gonna just hold the adductors. So you have a choice. You can either hold them because you don't want them to go forward with the knee. Flex, knee forward, knee back and step down. Or you can put them where you want them and just anchor with the pads of your fingers. Flex, knee forward, knee back and step down. Flex, knee forward, knee back and step down. Flex, knee forward, knee back and step down. And one more here. Flex, knee forward, knee back and step down. And at this point, you can see how I keep holding that tissue. I'm going to sink in with my elbow and take the tissue away from the ramus, and now turn tail under. Okay, and relax all of that. Great, now we're at the adductor attachments. I prefer to use their shorts if they're there, or a very thin sheet, which we have in here, rather than just skin on skin. Steve probably did skin on skin. Whatever you feel comfortable. You're gonna find the sit bone. You can feel the ramus, the shelf, and now you're gonna go straight down and Erin, turn tail under, I'll pose, and then relax it. When she relaxes, I go the other way. Turn tail under and relax it. Now hike your right hip up and I'll take the tissue down. Now you relax everything and I've got this tissue down. Okay, moving forward. Turn tail under and relax tail. Turn tail under and relax tail. Now hike your hip up. I'll take the tissue down and then she relaxes everything. Probably one more here. Turn tail under, relax tail. Turn tail under and relax tail. One more time, hike the hip and I'll take it down. Okay? Pelvic floor. Talk to them about the pelvic floor like we talked about. I generally will put one hand on the other hip, go back to the sit bone. Remember, the sit bone's gonna be about like right there. Just follow the hamstring straight up, find the sit bone, and then you're gonna go to the top of the shelf. And Erin, go ahead and Kegel, tighten your pelvic floor and let it go. I just do once when I feel that it's released, and then I move down the shelf. Kegel, tighten your pelvic floor and let it go. I will pause for a minute as it's starting to relax, but I just don't do any movement there or anything. Moving down, there's the shelf, the outside of the shelf. I'm gonna go to the top of the shelf, tighten your pelvic floor and let it go. And then moving back, and one more, tighten the pelvic floor and just let it go. Okay, good. Now, I'm gonna go ahead and just take all this tissue, kind of an integrative thing that we just worked on, and I'm gonna take this all the way down her leg while she flexes and floats her knee forward and back. And just one hand here, good. Taking this all the way down, okay? Good. And now turn onto your back, and I'm gonna do the medial hamstring. Okay, and now, we can get rid of it. Okay, so we're gonna just work on the medial hamstring, and that just looks just like this. very sandy table. You feel that, sand? It's like she's getting a loofah or something. Exfoliation.
Imagine you're at the beach and the
Yeah.
warm sand beneath you.
Oh my god. Oh, sorry, yes. Okay, good. And now we can do the pelvic lift. So 2 feet on the ground or on the table. And just gently turn tail under. Press your feet into the table and lift up just a little. Now roll down. Let me have your whole sacrum in my hand. And now, Erin, you don't have to do anything. And I'm just going to do a gentle pull there. I always love to come up. You can do a neck release. Go ahead and rotate head left. Okay. And come on back. Okay, now rotate your head right. And stay over there. Good, come on back. You can do the 4 quadrants. So turn head left. Now it's just down and out, down and out, and down and out, up and in, up and in, up and in, down and out, down and out, up and in, and up and in. Now come on back to the center and rotate right. Down and out, down and out, down and out, up and in, up and in, and up and in, down and out, up and in, and up and in, and come on back to the center. Have client roll to the side, swing your feet to the floor, push yourself up to sitting. And the back work is basically just getting, this is way too high, but you'll take your client to the bench. And what they're going to do is you're going to have your hands on the back. You're going to keep them upright. But the deal is just have them press their feet into the floor to find you and help them to try to find their medial line. So my hands are pretty close to the spine here, and I'm just having her press her hands into the medial line, bringing the tissue in towards the midline. Remember, when you bring tissue in, it's implying length. When you take tissue out, it's making things wide. That's it.